who's back with us, the chairman of the House Select Subcommittee on the pandemic. He's Chairman Brad Wenstrup. Congressman, it's good to see you. You know, we're hearing Democrats in the White House talking pandemic politics, talking things about booster shots, possible vaccine mandates. But we've got dozens of states now on the move. 21 are saying no to COVID passports. 15 states are saying no to vaccine mandates. From where you sit, Congressman, how do you see this?
Well, you know, I look at it in a couple of ways. One, as an American citizen, and then two, as a physician. And I will tell you, I guess there's no lessons learned from what we went through at the height of the pandemic. One, Americans love freedom and they love self-determination. And that's between the patient and their doctor, which has been eliminated. The doctor's out of the equation. It's politicians telling you what you have to do. And, you know, there's human nature has showed us that there should be lessons learned from what we did before. You have to know how to talk to patients. But people are not convinced, and they're not convinced for a good reason because there's not evidence. And then you see things, for example, where the Advisory Committee on Immunization Practices came out and said young, healthy people don't need boosters, yet the CDC started recommending them anyway. You know, where is the conversation with your doctor? There's an art of medicine, there's a bedside manner, and that has been absent, and there's no trust. Dr. Fauci has said, I'm afraid people won't listen if we tell them to wear masks again. Well, there's a good reason why, because they're not convinced. You see the Cochrane study that said they didn't do any good, and then you have people just arbitrarily saying, oh, the Cochrane study's wrong. Well, why is it wrong? I mean, this is the confusion that the American people are living through, and they're fed up with it, and it's angering patients across America. And mandates are a terrible idea. Americans don't do well with because I told you so. They need to be convinced that there's a good reason for this, and nobody's coming forward with best practices that make sense to the American people.
Yeah, it's so interesting. You brought up the Cochrane review of those dozens, I think 78 studies, saying the masks it's inconclusive that they work. You know, Congressman, this is coming up because the First Lady tested positive for COVID. The White House Press Secretary Karine Jean-Pierre telling the press the president will be masking while indoors, but watch this.
We encourage Americans to get those vaccines. We know that these vaccines work. President Biden tested negative last night for COVID-19 and tested negative again today. He's not experiencing any symptoms. As far as the steps he is taking, since the president was with the First Lady yesterday, he will be masking while indoors and around people in alignment with CDC guidance.
Explain to the press, I've been tested again today. I'm clear across the board. But they keep telling me because this has to be 10 days or something, I got to keep wearing it. But don't tell them I didn't have it on when I walked in.
Okay, you're joking about it. But, you know, Congressman, the point that the vaccines work, the First Lady was vaccinated and boosted, and she got COVID. Dr. Fauci co-authored a study earlier this year. We talked about it, how the vaccines don't work because COVID arises in the nasal cavity and sinuses where the vaccine goes into the bloodstream. So we're still having these debates months later. Why doesn't the White House acknowledge what you're saying, Congressman, that there are concerns and issues by Americans about all this? You have legitimate questions?
Well, why have we been denied the opportunity to debate medical treatments and everything else? Look, here's what we do know. I mean, when I sit there and listen to her say, we know that these work. No, actually what we do know from the very beginning, from the studies, is that the vaccine, even with the vaccine, you can still get COVID. We knew that from the trials at the very beginning, but we do know that some people were less likely to be hospitalized, and I believe it saved 100,000 lives, but it doesn't end there. That doesn't mean it's for everyone. You don't know the long-term negatives that may come from this 5-10 years from now. So you shouldn't act like it's just all fine, it's all safe. Maybe it is for some and not for others, like any other medicine. And so that's really misleading to people to do that. And so, you know, and then you see things like you just showed, but also I can remember when Senator Dole died and his wife is sitting there and President Biden comes in with a mask on, he takes the mask down and leans down in her face to talk to her. And America sees these things and he goes, what are you even talking about? So if it's that serious, if it has to be done, then why aren't people doing it religiously? Because the studies show that it isn't all there. We got to be honest with people. And so where I think vaccines have some role, we paid no attention to natural immunity either. I got vaccinated, I got COVID, they told me I need a booster, so we checked my antibodies. A strong number was 40, my number was 821.
Wow.
Sitting down with your doctor, the doctor would say, you don't need a booster. Go back to 2004, I think it is, Dr. Fauci with the flu shot, where they said, well, if you've had the flu, do you need the vaccine? He said, no, you have more immunity than you might ever want just by getting this. We've ignored that.
Okay.
So people understand this and are tired of it.
Congressman Wenstrup, that was terrific. Thanks for joining us. It's good to see you.